All right, thank you, Audra. Earlier this week, we reported on the first confirmed human case of West Nile in Douglas County.
Yeah, and health officials told us they've seen infected mosquitoes in a number of test groups at monitoring sites in the metro. So how can we protect ourselves this summer?
3 News Now reporter Corinne Hafuda joins us live with some tips. Good morning, Corinne.
Good morning. Mosquitoes, when you get bit by them, it's pretty annoying, but they're usually really harmless. But this season, it's important to take extra care because of the reported West Nile virus. Now you can just spray yourself like this, and that's it. That's all you need to do to protect yourself. Take a look at, all the tips that experts gave me and how to protect yourself this summer. Douglas County has its first confirmed case of West Nile virus in a human this season. It takes just one bite from an infected mosquito, and those mosquitoes get it from feeding off infected birds. The Douglas County Department of Health reported in 2018 there were 35 severe cases leading to hospitalization or death, and 36 mild cases of West Nile. So what does that mean for the people of the metro area this year?
People should know the risk that's out there. There's always a risk that's associated with the West Nile virus. There's a lot of mosquitoes out there. There's ways to prevent mosquito bites. So I think the public should just be aware of the ways that they can help reduce the chances of mosquito bites.
Mosquitoes mate in moist conditions, which could be stagnant water, even small enough to fill a bottle cap. Because of the floods this year, there are more mosquitoes out there than usual. The CDC recommends emptying things that hold water in and outside the house.
The mosquito that carries the West Nile virus is considered the house mosquito, is its name, because it finds really good breeding sites in people's backyards.
But just because you're bitten by an infected mosquito doesn't mean it's time to panic.
Most people don't even know they had it. Roughly 20% have a febrile illness, like a flu-like illness, and less than 1% have a neuroinvasive disease.
If symptoms occur, CHI recommends getting a blood test to test for the virus. Experts say there's ways to prevent getting bit. Staying indoors during dusk and dawn when mosquitoes are most present can dramatically decrease the chances of getting bit.
The best prevention would be, if you're going to be in an area with mosquitoes, to wear a mosquito repellent with DEET and appropriate clothing. So long pants, long sleeves. It's kind of hard when it's hot out, but it's something lightweight to protect mosquitoes.
Now, if you got bit by a mosquito and want to take extra precaution and are feeling some flu-like symptoms, it's important to go to the doctor and just get tested for it, just to make sure you haven't contracted the virus. Reporting live in Omaha, Corinne Hafuda, 3 News Now this morning.